So, good evening, friends. We are discussing regarding the Hahnemannian aspect about the different pathies which were prevalent during that Hahnemannian time, and he was explaining the what is there in antipathy, what is there in allopathy, what is there in the isopathy, what is the variation between homeopathy and the vaccination. All those things he tried to explain over there. So many examples of antipathy here mentioned in the last lecture. So these are the things which were prevalent strongly during Hahnemannian time, and that's why he has utilized, he has explained it in a truly true manner in front of the people. So we have finished up to the aphorism number 59, and in that big aphorism, many examples of antipathy were mentioned. Let us go ahead with the aphorism number 60. Again, from this aphorism onwards to the aphorism number 74, from aphorism 60 to 74, there are those footnotes which are given. All those footnotes are newly added in the 6th edition. Those footnotes were there, not there in the 5th edition, and they are totally newly added in this 6th edition of Organon of Medicine. So one must know all those things because these are the differences between the 5th and 6th edition of Organon of Medicine. So just if mention on your book from aphorism number 60 to aphorism number 74, all footnotes which are mentioned, all footnotes are big footnotes, and all footnotes are newly added in this 6th edition of Organon of Medicine. Let us start with the 60th aphorism, and then we'll go ahead. There was one question asked by Jayasri that I will answer at the end of this session. If these ill effects are produced, as may very naturally be expected from antipathic employment of the medicines, the ordinary physician imagines he can get over the difficulty by giving at each renewed aggravation a stronger dose of the remedy, whereby an equally transient suppression. Underline this, transient suppression. Transient suppression means transformation of the disease from the less important organ to the more vital organ due to the some local application or local treatment is called as a suppression. So if you continuously give antipathic measure, every time the dose required is always more than what is needed, and one stage comes, it gets palliated, it gets suppressed, and disease changes its axis. Then it transmits from the less important organ to the more important organ. Then it enters inside. And this is what is the suppression. So any person who was there coming towards you for the eczema, and if you are prescribing or applying some local steroid ointments, he was feeling better, then it was recurring again, and again he was feeling better. All those things used to happen. But one day it comes that the eczema vanishes and patient starts getting some asthma, or patient might get some renal problem, nephrotic syndrome. Some patients might get the brain problem. All those things can happen. And this is nothing but the transformation of the disease from the less important organ to the more important organ. And this is what is called as a suppression, whereby an equally transient suppression is effected, and as there then is a still greater necessity for giving ever increasing quantities of the palliative, there ensues either another more serious disease or frequently incurability, even the danger of the life and death itself, but never a cure of diseases of considerable or long standing. But never a cure of a disease of considerable or of a long standing. See what he is saying. If you are using antipathic measures off and on for the patients, and if you are continuing with it, generally it happens that there is always a palliation. If patient is having constipation, you are giving him purgatives, he feels better, again he stops taking medicine, again he develops the constipation, you again a purgative, and the dose required is going more the every time. And one day comes that constipation is relieved and some internal problem is started. So disease is shifted again to somewhere else. And this happens many times. And this is what is the suppression. So antipathy, for time being, it palliates, but if continuous use of antipathic measure can lead to the suppression. And this suppression is more dangerous when it affects the more vital organs of the human being. And this he wants to explain that antipathic measure, even though they gives the transient elevation, palliation, it is always harmful for the human body. So here he wants to explain all those things in front of you. There is a big footnote to this paragraph, and this footnote explains one more system of medicine which was prevalent during Hahnemannian time. This explains the Broussais physiological method of treatment. So a short note topic for the exam going students: Broussais physiological method of physiological treatment. So we'll learn what he wants to explain. Aphorism number, footnote number 66. All usual palliatives given for suffering of the sick have, as is seen here, as after effects, an increase of the same suffering, and the older physicians had to repeat them in ever stronger doses in order to achieve a similar a similar modification, which, however, was never permanent and never sufficient to prevent an increased recurrence of the ailment. So when patient goes on antipathic measure, there is always requirement is more day by day. If a patient is not getting sleepless patient, and he has given some sedative pills, after some, if he has given the 2.5 dose, then after some time he might require 5 milligram. After some times he might require 7.5 milligram. So gradually dose goes on increasing. This is what happens very commonly. So, and one day it comes that it never works and something internal problem aroused. And that is what is the suppression. So this footnote he wants to explain what is the concept of suppression. And thereafter he turns towards the Broussais. What he says, but Broussais, he was the person who has developed his physiological system, and what exactly physiological system is there, just listen. But the Broussais, who 25 years before contended against the senseless mixing of different drugs in prescription, and thereby ended its reign in France. Reign म्हणजे राज्य करणे, to rule over. So he was from the France, and he ruled over there, for which mankind is grateful to him, introduced his so-called physiological system without taking note of homeopathic method then already established, a method of treatment while effectively lessening and permanently preventing the return of the all suffering was applicable to all diseases of mankind, a thing that the palliatives then in use were not capable of effecting. What he is saying, there was one person called as, whose name was Broussais, and he was frustrated with all the allopathic mixtures used to use which causes damage. He said that it is better to treat the patients with his own method. And what he has said? He has said only one thing, that patients, all diseases are the result of increased blood inside the body. And if we remove this blood, then and then patient will be cured. And this is his own thought, this is his own speculation, and the two which he labeled by the name of Broussais physiological method. So let us see what he used to do. Being unable to heal disease with mild innocent remedies and thus establish health, Broussais found the easier way to quiet the sufferings of the patients more and more at the cost of their life, and at last to extinguish the life wholly, a method of treatment that, alas, seemed sufficient to his contemporaries. So this is the only method he has developed. And what is the treatment? He used to remove the blood, finish, that's all. Removes the suffering of the mankind by removing the blood. In the degree that the patient retains his strength, will his elements be apparent, and more intensely will be his pains. He feels his pains. So if the patient has a strength, he always complains, doctor, I'm having pain, I'm having pain, I'm having severe problem. He used to tell. But if you remove the vital fluid, that is the blood from the body, what will happen? The strength is vanished. Now patient doesn't have strength to say that I am suffering, I am having problem. And then he used to tell the patient's relatives, now your patient never complains. Now your patient is on the verge of cure because now he never complains. But problem lies that patient doesn't have a strength because of removing of the blood from his body. And this was his method called to be a physiological method of treatment. In the degree that the patient remains his strength, will his element be apparent, and more intensely will be he feels his pains. He moans and groans and cries out and calls for help more and more vociferously, so that the physician cannot come any too soon to give the relief. Broussais needed only to depress the vital force, to lessen it more and more, and behold, the more frequently the patient was bled, the more leeches and cupping glasses sucked out the vital fluid, for the innocent, irreplaceable blood was, according to him, responsible for almost all the elements. So his method was just applying the leeches and remove the blood. His method was to take the cuts on the body and remove the blood. His method was just to do a venesection and remove the blood. And concept was that all the diseases, all elements are because there is an increase in the blood inside the body. That was his thought. And to remove that blood, make the vital force weak so that patient will not have a complaint. That was his thought. In the same proportion, the patient lost strength to feel the pain and to express his aggravated condition by violent complaints and gestures. The patient appears more quiet in proportion as he grows weaker. The bystanders rejoice in his apparent improvement, ready to return to the same measures on renewal of his suffering. He be they spasms, suffocations, fears, or pain, for they had so beautifully quieted him before and gave promise for the further ease. So, what he used to use? He used to do only one thing, just remove the blood. After removing the blood, the patient used to uh, lose his strength. He doesn't have a capacity to express his complaint. And he was explaining to the relatives of the patient, now he never complains and he is normal. This was his method. And when patient starts complaining, he used to do the same work. He used to remove the blood by another means. But that was the only method which he used to use with all those patients. In diseases of long duration, and when the patient retained some strength, he was deprived of food, put on a hunger diet in order to depress the life so much more successfully and inhibit the restless states. Another physiological method was that patient should be kept on hunger diet. Nothing should be given to the patient for 2 days, 3 days, 5 days, like that. And because of which his strength was taken away and he never complains. Hunger diet complaint. Hunger diet treatment. The debilitated patient feels unable to protest against further similar measures of bloodletting leeches, vesication, warm baths, and so forth to refuse their employment. The death must follow. Such frequently repeated reduction and exhaustion of vital energy is not noticed by the patient. Already robbed of all consciousness, and the relatives, blinded by the improvement even of the last suffering of the patient by means of bloodletting and warm baths, cannot understand and are surprised when the patient quietly sleeps away. So this was the method, and which used to cause only damage to the patient's self. The patient day by day sleeps towards the death. Day by day, he was turning towards the death. No one was knowing. His strength has taken away. He was not complaining. And one day he vanishes. And things happen in such a manner that he used to tell the patient's relative that I have done each and everything. Even I have removed the blood from your patient, but his disease was dangerous. That's why he died. All such explanations were there with him. And these people, the Broussais and his followers, have removed the blood of the patient like a sucking of the blood. Second important thing, they have kept many patients on the hunger diet. That also lost the strength of the people, and those were died because of it. So his physiological method was a wonderful treatment used to produce more and more deaths at that time. But what he says, what Hahnemann says is very important. But God knows the patient on his bed sickness was not treated with violence, for the prick of small lancet is no really painful, and gum arabic solution was mild in taste and without apparent action. The bite of the leeches insignificant, and bloodletting by the physician done quietly, while the lukewarm baths could only soothe. Hence, the disease from the very start must have been fatal, so that the patient, notwithstanding all efforts of the physician, had to leave the earth. In this way, the relatives and especially the heirs of the dear departed consoled themselves. So they used to tell the relatives that I have done each and everything for your patient. I have given him warm bath. I have removed the blood from the patient. I have applied the leeches. I have done whatever is possible. I have done, but unfortunately, your patient doesn't carry on because his disease was strong enough. These were the explanations given to the relatives of the patient by the Broussais and his followers. Hahnemann have criticized all those procedures prevalent during his time, and these were the problems which used to cause more and more damage to the human health. So, what he one comment which he makes in this paragraph was very important. Hahnemann uses this very important comment. Just listen. The physicians in the Europe and elsewhere accepted this convenient treatment of all diseases according to the single rule, since it saved them from all further thinking, the most laborious of all work under the sun. What he says? Physicians, all of them have followed Broussais' method because they don't have to think anything. Just a patient comes, remove the blood, keep him on hunger diet, and that's all. Nothing to think what disease he is suffering from, what one can do, what medicine he can utilize. Nothing to think, just take the blood. So they are happy. This and they were followed the Broussais more. They only had to take the care to assuage the pangs of the conscience and console themselves that they were not the originators of this system and this method of treatment, that all other thousands of Broussais did the same, and that possibly everything would cease with death anyway, as was taught by their masters. Broussais काय शिकवलं होतं? What Broussais has taught to their followers? Ultimately, man has to live one day from this earth. So we used to remove the blood. If he dies, he used to die. Anyway, he will not going to remain on this earth forever. And they were, with hard-heartedness, used to tell all those things to the patient's relative and used to do and follow the same future. Same Hahnemann was fed up with all those things, and that's why he has written big paragraph about the Broussais. Well, next sentence was very important. What he says: in this way, many thousand physicians were miserably misled to shed with the cold heart. What word he used? With the cold heart, the warm blood of their patients that were capable of cure and thereby rob millions of men gradually of their life, according to the Broussais method, more than fell on Napoleon's battlefield. Very typical sentence which he has used. He said that it was they have sucked the blood from the patients more than whatever happened in the Napoleon's battlefield. So see, this was the condition of a medical field during Hahnemannian time, And that's why he has criticized and written directly over there regarding all those things. Was it perhaps necessity by the disposition of the god for that system of Broussais, which destroyed medically the life of curable patients, to precede homeopathy in order to open the eyes of the world to the only true science and art of medicine, homeopathy, in which all curable patients find health and new life, when this most difficult of all arts is practiced by an indefatigable, discriminating physician in a pure and conscientious manner. Indefatigable means न थकणारा, who used to work continuously, अविश्रांत काम करणारा, who used to continuously work and work. Discriminating, who used to think, used to discriminate, differentiate between things. And to conclude this paragraph, he says, instead of doing such a bloodletting treatment, keeping patients on hunger diet, it is always better to treat those patients with a method where there is no need to take away a single drop of blood. There is no need to keep the patients on hunger diet. But there is only one thing you can go for, is nothing but the homeopathic treatment based upon the law of similars, based upon the cardinal principles of homeopathy, and give that remedy which is based upon the totality of the symptoms and take away the disease in a gentle manner. So this whole paragraph he has written about the Broussais method, and that was very, very famous at that time. And he was the French person and who had developed, and he had many followers. So this concept of Broussais was criticized by Hahnemann in this paragraph. So for those students who are undergoing exams, they have short note topic Broussais physiological method of treatment. You have to write all those things. Then he turns toward the 61 aphorism. And in the 61 aphorism, he again explains few measures regarding the antipathic treatment. So we'll read the 61 aphorism. Had physicians been capable of reflecting on the sad results of antagonistic employment of medicine, they had long since discovered the grand truth, and everything is written in capital, that the true radical healing art must be found in the exact opposite of such an antipathic treatment of the symptoms of disease. They would have become convinced that the medicinal action antagonistic to the symptoms of disease and antipathically employed medicine is followed by only transient relief, and after that is passed by invariable aggravation. The converse of that procedure, the homeopathic employment of medicine, according to the symptom similarity, must effect a permanent and perfect cure, as it at the same time the opposite of their large doses, the most minute doses are exhibited. Now he starts comparing antipathy with homeopathy. In antipathy, they used to use a remedy based upon the contraria contraris curentur, and they used to give it in material doses. That is what is called as large doses. And as compared, when you give homeopathic treatment, you used to find it out remedy on the law of similar and used to prescribe remedy in a very minute doses. These are two important differences. And third important difference is that with antipathic measure, it used to produce only a palliation. Slight elevation means palliation, followed by an aggravation. But when you use the law of similars and give the medicine in a minute doses, it used to produce the permanent cure. So this comparison he tried to explain between the antipathy and homeopathy. But neither the obvious aggravation that ensued from their antipathic treatment, nor the fact that no physician ever effected a permanent cure of diseases of considerable or of long standing, unless some homeopathic medicinal agent was accidentally the chief ingredient in his prescription, nor it the circumstance that all the rapid and perfect cures that nature ever performed were always affected by supervention upon the old disease of a one of the similar character, ever taught them during such a long series of centuries, this truth, the knowledge of which can alone conduce to the benefit of sick. Conduce means to help, madat karne. Conduce means. So what he says over there, that it has been proved by many experiences that this is the only method which shows a permanent result. This shows an exact cure when based upon when prescribed upon the law of similars and in a minute dosage. Sometimes there was a habit of using the allopathic measures in mixtures, and he says sometimes such types of cures happen with those measures. Hahnemann said those cures are only because one of the ingredient of that might be a similar to the patient's complaint. And that's why such accidental cures have happened in by using those mixtures. And again, the principle was the law of similars worked because one of the ingredient was very similar to the patient complaint. But such a method which experience shows that is the only method which leads toward the perfect health, which leads toward the perfect cure. And this is what happens when you deal with the homeopathically. So he has explained the comparison between antipathy and homeopathy in this paragraph. And he wants to explain why antipathy never works permanently and why allopathy works permanently. Why homeopathy works permanently. This comparison he wants to explain over there. And then he wants to explain you again something, the actions of the remedy, how the antipathic measures or allopathic measures works, what are the different types of actions it used to produce, and how the homeopathic remedies works. So in tomorrow's sessions, we have to learn these actions, the primary action and secondary action of the remedy. So from the aphorism number 63 onwards, we'll have to learn these primary and secondary actions as explained by Hahnemann. And these are the truths which you used to find it out over there. We'll conclude over here regarding this antibiotic treatment. And tomorrow we'll start with the 62 aphorism. Yesterday also there was some question which remained to be answered, and there was one more question asked by Jayasri Kamble. Sir, can we treat systemic lupus erythematosus homeopathically? My first answer is that is it necessary to give the name to the disease? We are not treating the SLE, we are treating the person suffering from SLE. So there is no need to first give the label and treat the patient. Whether it is cancer, whether it is SLE, whether it is any other autoimmune disorder, anything we can treat with the help of homeopathy. So answer is always yes. Second question, and you have asked that, and which remedies are more indicated? No, there is no specific remedy. How can it be? Autoimmune disorders presents in a different manner. SLE is a big disorder. It starts with the skin, but it enters and penetrates to the different systems of the body. It is called a systemic, means many systems are involved in systemic lupus erythematosus. It is the erythematosus, where the erythematosus means it is the skin lesions which starts with, but this goes on progressing and enters inside the body, affecting different systems inside the body. Sometimes it affects the joints, producing the multiple joint affections. Sometimes it involves the nerves, producing neuropathy. So there are varieties of expressions are there with SLE, big disorder. Label given to this is the SLE. So there is no specific remedy. You have to deal with that patient. You have to take into consideration the whole disease and find it out the remedy for the patient. And that remedy is the constitutional remedy, because SLE, when it happens to be the autoimmune disorder. It starts as a psychotic miasm and leads towards the syphilitic miasm. So remedy should have either psychosyphilitic or either psychotic or either syphilitic, depending upon the severity of the disease, but no fixed remedy you can utilize for SLE. So that's the answer of your question, that we can treat the SLE, but without any specific remedy. The remedy is the patient's remedy. Any other query, any other question? No questions?
सर विचारू एक प्रश्न.
हो.
सर आपल्याकडे बऱ्याचदा सगळीकडे ॲलोपॅथिक वगैरे ट्रीटमेंट घेऊन आलेले पेशंट्स असतात. आता बऱ्याचदा सर स्किन अफेक्शन्स मध्ये म्हणा किंवा बॉईल ऍप्सेस अशा अफेक्शन्स मध्ये बऱ्याचदा त्यांचं सप्रेशन ॲलोपॅथिक मेडिसिन्सने झालेलं असतं. आणि जेव्हा आपण त्यांची कॉन्स्टिट्युशनल रेमेडी वगैरे काढतो आणि आपल्याला त्याचा रिझल्टही चांगल्या प्रकारे मिळतो, आणि मग समजा एक काही दिवसानंतर वी इन्क्रीज द पोटेन्सी ऍज द रिझल्ट आर गुड, आणि मग तेव्हा जर समजा तो रिकरन्स होत असेल पुन्हा, तर मग आपण रेमेडी चेंज करणं हे योग्य राहील का? आपण असं समजायचं की क्युअर इज टेकिंग प्लेस इन राईट डिरेक्शन.
कसला रिकरन्स होतो? विच रिकरन्स? रिकरन्स ऑफ द
स्किन इन्फेक्शन्स मध्ये समजा किंवा ऍप्सेस मध्ये समजा, बॉइल्स ऍप्सेस मध्ये, तर मग ते आधीच्या सप्रेशन्सचं असू शकतं का आपलं रेमेडी सिलेक्शन कुठेतरी रॉंग आहे असं असेल?
नाही, if it is a suppression coming out, it means that your remedy is correct. If the internal disorders are getting cured and if it is coming on the skin, it is well and good. But what Hahnemann have said, that these disorders, which are primary manifestations of the miasm, never heals immediately. It takes time to recover. So here you have to wait, you have to keep the patient, and you have to ask the patient to keep the patient. This is too important in such types of cases. Just now I will share a case. Today only I had a follow-up, a case of nephrotic syndrome of just child of 2 or 2.5 years old, very small child, and fully, this was just a third follow-up, means 1 month back I have started the treatment, and she was fully puffed all over the body, everywhere. There was ascites, there was effusion in the lungs, and she was on many steroids, everything, and diagnosed as a nephrotic syndrome. And when she was brought, they were frustrated because they were continuously giving the steroids without any result. She was looking like a Chinese, that whole the eyes were fully puffed, and I started her on the Apis, considering her I think Apis, or what remedy we have prescribed for that? Calcarea, it was Calcarea. Calcarea Kava I have prescribed in a LM potency. After the remedy, the whole puffiness disappeared, everything disappeared. And now she started getting the rash all over the body. Today only we had a follow. And whole body, there is a papular rash. And now she don't have ascites. Now she don't have any effusion in the lungs. Now she don't have even her normal face, which was there 1 year back. It is as similar to that have happened. But I have told the patient that now this will remain for next 2-3 months, 4 months. Don't apply anything. Let it come out first. Let it heal herself inside. And this is too important. You can use medicine later, but not immediately, till the system becomes recovered completely. So here, if you go, if you become impatient and try to remove this rash by any medicine immediately, it can re-enter into the again nephrotic syndrome. Here the waiting is very important. Your patience is very important in such types of cases. So if such suppression comes out, wait for some time, tell the patient the importance of it, why it has come, explain them detail. They are ready to understand, only they don't know why it has come. Tell them that it is not a remedies reaction. Many people feel that this is allergy. This is not allergy. Tell them that this is the way the cure should take place. Tell them that disease is going from in a right direction. And patient understand. तुम्ही त्यांना समजून सांगा की महत्वाच्या अवयवाकडून कमी महत्वाच्या अवयवाकडे आजार चाललाय. पेशंटला नीट समजून सांगा की अरे पूर्वी त्याला किडनीला आजार होता, पेशंटचा धोका खूप होता. आता किडनी क्लिअर झाली, आता त्वचेवर आलाय, जीवाचा धोका टळला. आता थांबा, थोडी गडबड करू नका. If you tell them in a proper words, then they understand and they remains with you. And this is the way we have to treat. Any other query? Is it okay, Madhu?
येस सर, थँक्यू सर, थँक्यू. मी फार इम्पेशंट झाले होते, आता मी रिलॅक्स आहे सर. थँक्यू.
Best answer is to give the placebo more and more.
येस सर, येस सर.
Okay, so we'll meet tomorrow again with the next aphorism. Thank you being there, Dr. Karuna and Ali, Dr. Anita, Dr. Pasuna, Sir, Payal, everyone is there. Thank you very much being there, being a part of this session, and we'll continue with it. Today on Divine School, there is a one lecture by Dr. Vinod Urade. He is my student practicing and very sincere student. Just listen what he wants to. The ways of prescriptions he used to take at 9 o'clock. So those who have joined the Divine School of Homeopathy, they should attend that session. And those who have not yet joined, my suggestion is that to join our school so that you can learn the practical aspects of it. Thanks a lot.
Thank you, sir. Thank you.